This Good to Go segment is sponsored by Spectrum Health Medical Group.
March is Colorectal Cancer Awareness Month. It is the second leading cause of cancer death in the U.S. Dr. Randy Meisner is a gastroenterologist with Spectrum Health, and he joins us now to talk more about what is a pretty preventable and even curable disease. Hi, Dr. Meisner.
Hi, how are you? Thanks for having me.
I am glad to have you and doing well. Thank you. I mentioned colorectal cancer being the number 2 leading cause of cancer death in this country. What are the symptoms?
Well, that's the problem, is sometimes there are no symptoms. And patients are oftentimes don't know that they have anything going on. If there are symptoms, usually there's going to be rectal bleeding, usually in the form of bright red blood coming out of the rectum. Sometimes it's black stool. Sometimes patients are having abdominal pain. Sometimes they're fatigued or having weight loss, or oftentimes there can be what's called anemia, which is a low blood count that's found on routine labs. But again, that's the problem. Sometimes and many times there are just not any symptoms.
Is a colonoscopy the only way to screen?
No, a colonoscopy is not the only way to screen for colon cancer. So we believe as endoscopists that a colonoscopy is by far and away the best way to screen for colon cancer. Now, that's a well-done colonoscopy, a colonoscopy where the preparation is good, and that's sometimes on our end to educate the patient the importance of a good preparation, and a colonoscopy that is well done, where time is taken by the endoscopist, the person doing it, to look for polyps, to clear the colon of any secretions or any remnant stool, and to be able to identify polyps that are precancerous or flat or ones that can evade detection. However, there are other ways to screen for colon cancer, whether it be CT scans, stool blood tests as well. In the end, for a average risk person, a healthy person, or even somebody who is elderly with other medical problems and comorbidities, usually a colonoscopy can be done in the vast majority of those people. As we like to say, though, any test is better than no test at all.
I understand there's been a change in the age at which that screening should happen. It went from 50 to 45. Why was that?
Well, that was because we were over the last several decades finding a higher incidence of colon cancer and colon polyps in young people. We don't really know clearly why that is. There's been all sorts of suggestions as to why, whether it's food additives, genetics, earlier recognition. We don't know, but when society guidelines kind of stratify the risk and benefit and cost in the population, 45 has now been deemed the age to begin colon cancer screening.
Is there anything you can do to reduce the risk?
Well, we can't pick our parents, right? Many of us would love to, but we can't. So genetics do play a big role. However, like most gastrointestinal cancers, the best risk reduction is avoiding diets that are high in fat. Of course, fruits and vegetables are good, smoking cessation, and limiting alcohol intake.
You mentioned the family connection. Is that the predominant unavoidable risk?
Right. Well, that isn't avoidable. There are genetic conditions that are uncommon that people can have that can predispose them to hereditary components of colorectal cancer. But then oftentimes there are genetic risks in somebody who just has a family history of colon cancer or large polyps, which of course we can't avoid our genetics, right? And then there simply are sporadic mutations where, again, for reasons we don't really understand, people could just acquire a mutation and develop a colorectal cancer.
All right, screening though the best way to catch it early and survive it. Good news there.
Absolutely.
Folks, if you would like to support people in the community suffering from colorectal cancer, consider donating to the Spectrum Health Foundation Colorectal Cancer Fund. It raises money to educate the community, drive awareness, and you can find a link at 13onyourside.com. Thanks, Dr. Meisner.
Thank you.